Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala, and Dr. Richard Jensen, who is also a board-certified acupuncturist, practiced independently in Shoreview, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimal health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It is great to have you with us again today. If you're interested in having a healthy mind or a healthy body, this is the place to be. It really is. As the announcer said, Dr. Jensen and I are chiropractic physicians. We practice in Shoreview, Minnesota, which to some of you is in the northern part of the United States, Central Plains. And because we know there are many of you that watch us in Asia and Europe and all over the world. So that's where Shoreview, Minnesota is. It's a wonderful, wonderful place to live 9 months of the year, unless you like a lot of snow and ice the other 3 or 4 months of the year. Today we're going to talk, as I said, about healthy mind and healthy body. And Dr. Jensen and I, of course, are licensed doctors of chiropractic. He's also board certified in acupuncture. And I'm a diplomat of the National Board of Chiropractic Examiners and have some other certificates. But our major approach, we take care of strains and sprains and auto accidents and workers' comp injuries and things like that in our health center. But we practice really orthomolecular medicine, meaning that we're looking at the whole person. And today we're going to look at the body and mind with reference to a subject called neurotransmitters. And so neurotransmitters, everyone has them in their body. Healthy people have healthy levels of those neurotransmitters, and people who have health problems usually have some issues involving deficiencies and or excesses of neurotransmitters. So I guess that begs the question then, Dr. Jensen, what are neurotransmitters?
Thank you, Dr. Lala. Well, neurotransmitters are basically the chemicals that go between the communication between nerve cell to other tissue or to other nerve cells. They follow through a synapse, which is a gap that's usually almost formed like this, where you have chemicals being released from this side that go into like a lock and key mechanism over here to send a signal from one side to the other. These neurotransmitters are amino acids. They're built from amino acids. And there's some of them are built to excite the activities of the nerves, and others are built to inhibit the activities of the nerves. So sometimes there are those that raise up your energy and make you feel, wow, pumped up like the adrenaline of the brain, and then there are some that help keep you the nice, calm, smooth. Some of them will actually make you feel like all is well with the world, and others are full of anxiety.
Then are there certain common symptoms or conditions that would be related possibly to neurotransmitter problems?
Certainly. Common conditions related to neurotransmitters, irregularities in these can be multiple sclerosis, muscular dystrophy, chronic fatigue, insomnia, fibromyalgia may also be a result of that. Mood swings, certainly mood swings. Depression is a big one of those. Neuropathy, hormone problems, as well as impotence can also be related to irregularities in neurotransmitters.
And, the majority of the people that we see in our clinical environment with conditions such as this, their neurotransmitters very, very seldom have ever been checked, right?
Right, right.
So there's missing a link in the correct diagnosis then.
Right. Well, one of our mottos is if you don't measure it, you can't manage it. Neither do you know what the baseline is for this particular person. And so we like to go in and see what the baseline is for the person, see where there could be corrections that are being made, and help them to make healthy choices in correcting those things, as well as, in some cases, give them the particular amino acids that they need to create those. A great illustration of that is if you go into a meeting, like a board meeting at work, many times they'll put out a selection of donuts or something like that people are able to take. And what happens is the sugar that's within those donuts actually, sugar is like a signal transport for amino acids into the muscles. And when it does that, it pulls almost all the different types of amino acids in there, except for tryptophan. And tryptophan is an amino acid that's particularly used for serotonin. That's the neurotransmitter that makes us feel it all is well with the world, okay? And that tryptophan being in high levels in the bloodstream are being picked up by the brain. Mm-hmm. And being picked up by the brain is creating more of that, so that people tend to feel much more relaxed and much more agreeable in these meetings. And they find more things get passed along through those meetings because there's like a lot of, if you want to go with the cliche, a yes man kind of thing, that they're not agitated in there.
And then when they leave the meeting, the sugar level drops down.
Yeah.
And their energy goes, whoop,
Yep.
right down the door.
So it takes out their work ethic for the afternoon.
So what are some of the common related neurotransmitter irregularities then?
Well, first of all, if we look at some of the common neurotransmitters, there's cortisol, cortisone, which are stress-related neurotransmitters, DHEA, dopamine. Dopamine is also one that you use that's primarily looked at for depression. Estrogens, estradiol, epinephrine is like the brain adrenaline. GABA, histamine, melatonin, PIA, which is an acronym. It's a pretty long word. I'm not going to say it now. Epinephrine is like I said, that adrenaline. Progesterone and serotonin is the one that we had just talked about.
It sounds then
Also.
like a lot of these chemicals are manufactured or designed by God to be manufactured, synthesized, and secreted by the adrenal glands then, is that right?
Yeah, and in fact, when you look at the adrenal gland, it's actually an extension of the brain that's put in the center of the body to release these neurotransmitters so that it can be sensed by the rest of the body much quicker. So
they
you
sit
have-
on top of the kidneys then?
They stand up on top of the kidneys, and what's important with that is that 25% of your blood flow goes through the kidneys. So it's got your blood available to it right then to be distributed to the body. And when we're talking about in the brain, there's norepinephrine, and in the body it's epinephrine. And so they're basically the same thing. They're just saying that. In the adrenals, it's epinephrine, and in the brain, it's norepinephrine. So it's adrenaline that affects either the brain or the rest of the body.
So then the hormones that you mentioned, many of them are manufactured, they're called adrenocorticosteroids then?
Yes.
They're coming from the cortex of the adrenal gland?
Yes.
Good, interesting.
An interesting thing is where we were talking about serotonin and how it's related to the brain. Serotonin is also used in the digestive tract also. It's the thing that starts the digestive tract of moving the food through. So many times if you have an imbalance with that, it's also affecting your gastrointestinal area also.
So then many people with digestive or gastrointestinal issues then could have a neurotransmitter
Certainly.
problem, right?
Certainly. Some of the ancient civilizations, like the Japanese call it haragi or belly knowledge. We know it as butterflies in your stomach when you're nervous and things like that. It affects your gastrointestinal system. In fact, some people call it the second brain because it has almost as much nervous tissue that surrounds the gastrointestinal tract as is encased in your head. So you have the same amount of nervous tissue, the same amount of neurotransmitters that are down there also.
Interesting. So what about the adrenal glands? I mentioned the word corticosteroids, but then there's glucocorticosteroids too? Can you discuss those then?
The glucocorticoids are primarily your cortisol And they play significant roles in the health also, in that they can affect the nervous system, the heart, the lungs, your circulatory system. Your circulatory system, in the point that your nervous system controls whether your blood vessels are dilated or constricted. Metabolism, it can affect your musculoskeletal system. Definitely, if your nerves are primed to work or not, and that's looking at these corticosteroids being more stress hormones. So that, say, with the stress hormone out there, it shuts down the blood supply going to your gastrointestinal system and opens it up to the muscular system so that you can more effectively participate in the fight or flight. Also, the immune system, it'll affect that also. It shuts down your immune system when you're under stress and makes you more susceptible to some of these other diseases as well. So they're very important in how they react to the entire body. Let's go on to how about the thyroid gland also. One of the things that we find is when we're under stress, stress first affects your kidneys and your adrenal glands. And if, as in our world today, we don't have a shut-off of a lot of those stresses, they're chronic and continue on and on and on. And so what we find is, first of all, the adrenal glands start to get worn down. And in chronic stress, then what it starts to affect next is your thyroid. And your thyroid gland actually regulates a lot of your metabolism, the speed of your metabolism, so people will start to get fatigued and just not have energy from that. So when you're looking at the thyroid gland, it secretes thyroxine, which is a hormone involved in your basal metabolic rate, and so you'll start to gain weight if that starts to get worn down. It also affects the nervous system. And what we find also is that the digestive nerves can affect your pituitary glands and your kidneys and your liver, as well as hair. So we start to look at things like hirsutism and things like that can result.
What about sex hormones then?
Well, that brings us on to if it's affecting the adrenals and it affects the thyroid, then you start to look at the other systems that it goes after, and one of those systems would be the sex hormones, as well as the sex hormones that are given off by the kidneys. What we find is many times when women hit menopause, it's usually your estrogens and so forth are being created about 80% in the ovaries and 20% in the adrenal glands. And then as menopause hits, your ovaries start to give off less and less of this, and your adrenal glands are supposed to help balance that out. Hopefully. But if they're already, if it's already
compromised or fatigued,
then it can't do that job, and we start to have this swing and so forth of those hormones, adding much more to the perimenopausal symptoms.
So are there some principal hormones then?
Sure.
Sex hormones?
We're looking at testosterone and progesterone, of course the estrogen family, and then there's DHEA, which when you're looking at the cascade of how these hormones are made, it's normally from cholesterol that's created, and it goes right on down, and DHEA is that nexus road that if there's a problem with that, then all these other things start to fall away. So that creates more problems.
Well, Dr. Jensen has mentioned the nervous system, and that would cause us to think about the nervous system, and I guess you could say one of the specialties of very good chiropractors would be nervous system specialists. And of course, we have three nervous systems. We have the cranial nervous system, we have the autonomic nervous system, and we have the peripheral nervous system. And so the spine houses and protects these nervous systems. And so you could look at vertebra then as like the switchboard of the nervous system. So we have Atlas up here. The top vertebra is like holding Mr. Atlas up. And then we have 7 cervical vertebrae, 12 thoracic or mid-back vertebrae, and 5 lumbar vertebrae, and they all house and protect the spinal cord. And so we can look at that, and then of course at the end of the spine, as we're looking at your far left, we see the spine from the side. There on the far left, we see a curve. We see three curves. There's a slight forward in the neck. Dr. Jensen's making that move for you now with different flexibility. These are normal curves, and then he's bringing up some abnormal curves for you. That's called a thoracic. You're talking about thoracic kyphosis. Why don't you discuss that, Dr. Jensen?
Sure. If we look at this, here we go. Where we're looking at in the cervical area, we have a forward sway to the neck, and this curve here is called a lordosis. When it's curving in from, if this is your back and this is your front, this is a lordosis, and then this curve here is called a kyphosis, which is primarily in the thoracic region. And down here is the lordosis again. And then here, you could call that a sacral kyphosis as well, because it has that curve. And really, when we look at this curve, we started out with a C curve like this, just a total kyphosis. But when we started to lift our head as a baby, then we developed this lordosis. And then as we started to stand up and walk, then we create this lordosis. And over here, this is just the spine that's just rotating here. To show you the different aspects, and you can see how up here we have a totally different structure as to the structure in here, and then we have a totally different structure here as to the spine. So these three areas actually look completely different. You can see how it spreads out much wider in here, the larger canal for the spinal cord. It actually gets thinner through here, and then wide again down in here.
Then we could probably look at a segment of those vertebra. What you see in front of you now on your far left is A, B, C, D, E, and F. And this would be an illustration of some vertebra. We're looking at them from the side. The fronts on your far left, those are the bodies, the fronts of the vertebra, the anterior surfaces. And between each vertebra is interposed a spinal disc. At least in the adult spine, normally or typically we have 23 vertebra, or 24 vertebra and 23 discs. So Dr. Jensen is pointing out a disc there. It's in blue if you have color. And then now he's going to point out that yellow area, which is like a canal, a window. It's called the intervertebral foramina, where the nerves pass out or emit. But interestingly, with those nerves pass arteries, veins, lymphs, and acupuncture meridians. Now, if we go down to the next vertebra, D, we see a vertebra that is subluxated, or an illustration of a subluxation or a minor dislocation where the vertebra is slipped backwards or posterior. Now what that does is it kind of jackknifes down on top of what you see there, that red illustration, which could be the artery coming out of there, and a nerve and a lymphatic and a vein and an acupuncture meridian. So it could take as little pressure as the weight of a quarter to interfere with the proper flow of the energy that's passing through the arteries, the nerves, the veins, the lymphs, and the acupuncture meridians. So the vertebra below it there now is in normal alignment. And so typically what the chiropractor is in part educated to do is to diagnose issues of that nature, and then has very specific adjustment procedures to attempt to correct or push those vertebrae back in proper alignment. Now there are some different ways to determine that. One is certainly by range of motion testing, what we call orthopedic testing. Another is, but the most scientific way is to have x-rays of those specific areas. And in my opinion, after all of the years that I've been in practice, I think it is highly dangerous to manipulate spines without spinal x-rays. And you were going to say something, Dr. Jensen?
Well, I was looking at this picture that we had up here, that when you look at the this disc here, as that's been pretty much compromised here, you have to look at, there's a connection between here that this disc is adhered to this through some connections called Sharpie fibers. And so by moving the bone, you're actually helping. If you move the bone back in place, it actually helps the disc reposition itself underneath there, helping the disc health. The other thing is if this stays out like this, it starts to create some degeneration in these joints back here, and many times that increases some bone formation in here, which will permanently start to place pressure on these nerves. And so that's why it's important to get care so that we don't have the long-term effects of it being out of position like that.
And there are some people that go to chiropractors who will make a full spine x-ray of them, thinking that that's a diagnostic x-ray. And a medical and chiropractic radiologist, by and large, would not say they are not diagnostic x-rays. They are postural x-rays.
Right.
And so you can miss many things on a full spine x-ray that you would pick up on a focused of the neck or the mid-back or the lower back.
That's a very, very good point.
And also interestingly is that if you have x-rays made at a medical clinic, those films are going to be analyzed by a medical radiologist. Now, the problem in chiropractic, in my opinion, is that we have board-certified chiropractic radiologists, and they're excellent men and women, just really, really good at what they do. But the majority of chiropractors, the mass majority of chiropractors, and I sadly admit this as a doctor of chiropractic myself, but the mass majority of chiropractors who do take x-rays do not submit those x-rays to a radiologist for second opinion. And I want to tell you, there is as many x-rays that I've looked at in nearly 50 years of practice. Every time we send out a set of films, and in our case, we send out all of our films to chiropractic radiologists for second opinion, they always seem to come up with something that I didn't see or that I had a question mark about. And so one of the big issues of malpractice in chiropractic is, one is they don't take an adequate case history, they don't take x-rays, or they take minimal x-rays, and they do not send those films out when they do make those x-rays for second opinion. If you're going to a doctor of chiropractic who is doing any of those things, not doing a thorough history, not doing a thorough examination before care, not making x-rays of the involved area, and not having those films read by a radiologist, the risk management of malpractice, that risk factor goes up and up and up. And I may have a wonderful personality, you may like me, I might be of the right religion or right hair color or right eye color and things like that, but that does not make me a good doctor, does it?
No, you brought up a really important point. Though we've both received just superb educations in looking at x-rays.
Right. It's not the chiropractic college's fault. It's what they do when they get out of chiropractic college.
We've received superb educations
They
in that.
devalue their education.
But let's also look at it from the point that the radiologist, the person who's reading films from all over the country, is going to see weekly what I might see once in my practice. Who's the guy who's going to be more astute in seeing that? Is the guy who's seeing them weekly and knows how to identify that from there. And so I like to use experts. I like to use experts because that adds more to my credibility.
It doesn't cost money. It saves health, and when you save health, you save money.
Oh, definitely. Definitely. Another thing, I brought up this slide from what you were talking about with full spine x-rays. Incidentally, when you look at an x-ray that's been taken at a full spine, it's taken from a beam that goes to the center of the spine here and from back here. And what happens is many times they say that looking at a side view of this, it'll actually make this curve appear to not be there. So then it can actually manufacture postural problems.
And so this brings up the issue, and I think this is something that needs to be addressed by both of us here, Phil. There are, unfortunately, some chiropractors who belong to certain management companies. They're called coaches. Now, it goes on in dentistry and medicine as well, so it's just not the chiropractors. But what they're telling those chiropractors to do is to do a very, very quick case history, take a AP, a front to back, and a side-to-side x-ray, sell that person, particularly if they have some kind of insurance, on chiropractic care, and then within a month or maybe a little bit longer, to remake those x-rays. And what they do is they go then and they change where that central ray was. They can make that spine look better when in fact it hasn't improved. Am I saying that correctly?
It's very hard to reposition a person in the exact position that you took the first x-ray in. So in which case, it will appear to have been better on a small, we're talking millimeters in difference. And many times they will say, see how it's improved.
And it really hasn't improved. It's that they changed where that central ray one that makes the spine look better. So let's go back and talk about subluxations here
Okay.
again.
Okay. So then what we have here are two segments of the lumbar spine, actually. That's where these came from. This model is made from. And what we have are the posterior joints here in the spine. That's the zygapophyseal joint. And what will happen is sometimes you'll get an inflammation within here, an irritation that creates some swelling in there, or there's been a malposition in which muscles have pulled these things out to the side. You have muscles that go between here, muscles that go between here, and usually a couple segments above that all rotate this. And by the way, muscles move the bones, okay? So then what happens is we can have a subluxation or a malposition that this may be a normal range of motion for this segment, but there's swelling, there could be swelling in here that is holding it out of place. And the chiropractic adjustment helps to relieve that irritation that's within that joint.
So we're talking about chiropractic correcting those subluxations. How about how are diet and nutritional deficiencies affect neurotransmitters then?
Diet and nutritional deficiencies can come in the form of lack of probiotics, lack of essential fatty acids, excessive meats, excessive dairy products, excessive processed foods, excess refined carbohydrates, excessive foods containing yeasts and fungi that brings an imbalance.
And then there are some unsaturated fatty acid foods that are generally good for neurotransmitters. You might want to consider them, including fish oils, seed oils, olive oil, fresh fruits, and fresh vegetables. And then, of course, neurotransmitters are affected by what we call electrolytes, which are minerals. They all have either a positive or negative charge, and there's a way to determine them. So neurotransmitters can be can be determined the most inexpensive and easy way through urine testing, collecting urine, and then you send that to the lab and they analyze it, and you always want to match that with a blood analysis, which we call a chem screen, that is not only evaluated from a clinical but a homeostatic perspective. And because neurotransmitters are affected by electrolytes, certainly we want to have those electrolytes determined in the blood sample as well as in a hair mineral biopsy. Some of the vitamins and minerals that are particularly important for neurotransmitters are the B-complex vitamins, preferably yeast-free. We don't prescribe or recommend any B-complex vitamins that have yeast in them. We just don't use any yeast-based vitamins whatsoever. The mineral magnesium is important. Folic acid is important. The mineral manganese is very important. Certainly selenium is very important. And amino acids, a lot of those that are sold by chiropractors and nutritionists and in health food stores and drug stores will not have the level of the amino acids within them that the label says. Nobody does an independent laboratory analysis to check those out. And another mineral that's very, very important is zinc for the amino acids and for neurotransmitters. Another test that I didn't mention that is really, really important is a test called organic acid analysis, which determines the existence of malfunction within the gastrointestinal system, which we refer to as dysbiosis, and it measures the byproducts or the metabolites, the byproducts of yeast, fungus, as well as potentially pathological bacteria. So we've covered a lot of information today. Again, you can go out on our website, download this program and many others on neurotransmitter or any other health problem. I think you'll find it of interest and value to your health.